This workshop is really about different sources of NIHR research funding. So a bit of information about, I guess, the range of opportunities that there are there. A bit about the research design service in the Northwest, who we are, what we can do, and hopefully how we can potentially help. And then the and you bit is really for you to talk about kind of what kind of research ideas you're interested in and have some conversation with each other and with me about kind of what might be the next steps for you in terms of kind of research proposals or research ideas you're thinking of. My name's Chris Hatton. I work at Lancaster University, and part of my job is to help to run the RDS in the Northwest. But it's not the whole of my job. But as is required, I am wearing my official I am NIHR badge for the occasion. When I'm not involved in NIHR work, obviously I had to take it off, but I am wearing it. So NIHR research funding, it's a, I presume you've all heard of NIHR? Yes, I'm getting nods. I guess what some people don't realise about NIHR, I guess it's really a major research funder of quite a wide range of applied health and social care research in England, and in some cases across the UK. The focus is on applied research. Applied basically means not kind of basic bench science type stuff. So the rule of thumb that NIHR uses about what applied is if there's a chance for it making a difference to patients or people's health within kind of about 5 years of your project finishing. That can be a bit of a kind of an elastic or fuzzy boundary, but that's the kind of rule of thumb they're thinking of. So if your research has no chance of reaching that point in that time frame, then they might think it's out of scope. It's around health and in some respects around social care. So health for some schemes seems to mean NHS or health service patients. For other schemes, it can mean health related to anybody, whether they're using services or not. And there are branches of NIHR that are more that specifically fund work around social care, and some of the other schemes may or may not include social care work. As I've mentioned, it has to be designed to have a potential advantage to people within 3 to 5 years of the end of your research. And there's a real mixture of types of funding. So some of them are, some schemes at some times put out very specific calls for research. So we want to call, we want to find something about this very specific area. Sometimes there are themes which might be within a scheme or overarching. So they had one last year about multi-morbidity in older people, for example, and that was a theme that they were looking for applications to across the whole range of funding schemes that they had. And some of them are response mode. So basically, if you've got a good idea, you can submit it without having to wait for a call for something that fits that. And it's part of the NIHR sees these kind of funding schemes as part of a chain from invention through evaluation to adoption and diffusion. So you get, oh, that's in the wrong place. Anyway, just to say, if you're tweeting, that's the hashtag. Our Twitter handle for the RDS cross country is NIHR RDS, and at the bottom there, is this a laser? Oh, it is. I just can't make it. There you go. I'm getting there eventually. There we go. That's our website for the RDS in the Northwest. And that's just because that's how tweeting feels like to me, rather than the nice little Twitter bird. But anyway. So from invention through to the other endpoint. So this is how NIHR are fond of very complicated graphs explaining what they're doing. And this one's no different. So you see from the invention through to the other end where things actually make a widespread difference in services, most of the NIHR research schemes are kind of around here. So they're about taking something which has been developed or helping to work out what that is, through to evaluating that, and then through to, well, can you get that into use in services or communities in ways that make a potential difference. And then it links in with things like clerks at this end and so on. So you can see, I'll describe some of these a bit, but you can see there's a wide range of schemes. So when you're thinking about NIHR, and I know this is impossible to read, but we'll come back to some of these in more detail, there are actually really possibly a wider range of schemes and opportunities there that you may have realised. So some of these, how many people have heard of RFPB? Yes, some people, that's good, that's great. So this is a kind of national response mode program, so it doesn't set priorities, it's for people to submit their ideas. And it's operated through regional panels. And 3 times a year, so it kind of comes around in a very regular way. They're changing some things about how you apply to introduce an outline element, which they didn't have before. But it's 3 times a year, so they come round regularly, which is helpful, I think, particularly when you're kind of busy and you're struggling to hit one deadline. You think, well, actually, this isn't a one-shot opportunity. There's one along in 4 months. As the scheme has gone on, it's kind of broadened the range of research which it might fund, and it has kind of various kind of fuzzy boundaries within that. So there are some projects up to £100,000, which they're saying are kind of like a bit more sort of risky or less certain to yield a benefit, or yes, less likely to. And also things which didn't easily fit within other schemes. So for example, working on a new measure of something which doesn't exist, or a new tool. Then as you go up to 250,000 and 350,000, they're looking at bigger projects. They're particularly looking at, increasingly they're getting applications around trials. But obviously it's very difficult to do a full trial within £350,000, amazing as that may seem. So they're really interested in the kind of the early phase stuff. Is it feasible to do this? Will people actually be recruited to such a thing? Is it showing promise to lead in later on? And projects are a maximum of 3 years. At the other end of the scale, I suppose, are programme grants for applied research. Again, this is a national response mode programme, so you can put in any idea you like. They do sometimes have themes. And this can get you up to £2 million over 3 to 5 years. And there are regular rounds there too. And it's worth looking carefully. They have quite a lot of guidance on what they think fits or not. And it's worth looking at that because it's changed a bit over time. So there used to be schemes where there were lots of bits. So, in my £2 million, I've got 5 work strands and they're all quite separate. And now they seem to be looking for things that are more integrated across that time period. There is also a scheme where you can kind of have a year, if you like, to get everything ready for a full programme grant application. So that's worth looking at too. HS&DR, Health Services and Delivery Research Programme. This is this is quite an interesting programme. It's moving more towards kind of implementation type stuff and how things actually happen in real services. So rather than having an intervention necessarily which you're testing in an RCT type way, it's asking, you can ask a range of questions around what's actually happening in services, what are the factors that seem to promote a good service. If we have an intervention, what happens if we actually try and introduce it somewhere? Will that work? And so it's a scheme that has quite a broad range, but it's quite fuzzy, I suppose. And it supports many types of research, sometimes including evidence synthesis too, which is systematic reviews, but it might be also different ways of synthesizing the evidence. They have some open response elements. They have sometimes theme calls, and sometimes they have very specific calls, usually in response to kind of a policy priority. So we really need to know something about antipsychotics and older people, for example. The Public Health Research Programme, this is a really interesting one, interesting to me with some of my work, because it's one of the few NIHR schemes which doesn't require you to work with patients or people using the NHS. So obviously public health can have a completely kind of community focus that doesn't involve health services at all. So it's much more about research to evaluate non-NHS interventions intended to improve the health of the public and to reduce the kind of the unequal status in health that there can be in all sorts of ways. So I don't know if you've heard the NHS Health Atlas, which was published this morning, which is showing massive variations in service supports across pretty much anything you care to mention. The scope is really broad, so I think if you're interested in that, it's a really interesting scheme to look at, and they're very interested in, I guess, in kind of innovative different ways of doing things. They fund primary research and secondary research, which is often kind of analysing existing data. And as time goes on, I think, this whole kind of big data agenda, I think for public health research and for other types of research, there's big opportunities there, particularly as we get better at linking data across sets of data. And again, they can be open response, they can be themed, or they can do specific calls too. So I'm involved in one at the moment, which is trying to map how public health research treats or doesn't treat disabled people. So are disabled people included in public health research? If not, why not? What are the models of public health research? Why are they excluding people? And how can we kind of bring those very different understandings of what's happening together? The HTA program, this is the biggest program, and this is primarily, although not exclusively, concerned with randomized controlled trials. It funds independent research about the effectiveness, costs, and broader impact of healthcare treatments and tests, and it's about kind of the NHS quite broadly. They have a mixed portfolio of clinical trials at various stages, from kind of the full trial back to pilot feasibility studies and evidence synthesis as well. And again, they have open response, themed and specific calls, and some of those are about specific topics or specific interventions, but some of them are about methods. I guess some things are very kind of exercising the NHR at the moment. One is recruitment. So one is how many NHR-funded studies, particularly of trials, don't recruit the numbers they say they're going to. And that is a big issue, obviously, for kind of research funders. The other, I guess, is how you can make more efficient use, a more creative use of the resources you have. So there is a concern about the length of time it would take to get from the idea of an intervention through the stages of trials to the point where you have something which you can implement. And then even if you can implement that, is it going to make a difference in practice, even if it worked in your trial? So they put out a call for efficient designs, for example, or lower cost ones, where you can use existing data potentially to evaluate an intervention, or you can do some things online, for example. So they're getting quite creative, I think, and they're getting quite interested in different ways of doing trials. The EMI evaluation, there's quite a fuzzy boundary between this and the HTA program. EMI funds clinical studies to test interventions where proof of concept has already been shown, allowing their progress through early clinical trials and onto later, larger ones. So they are they're usually at a kind of earlier point in the intervention than the HTA, for example. So I'm involved in an HTA multi-site program looking at behavioural activation for depressed people with learning disabilities. And in that we had a stop-go point where if we hadn't recruited enough people by a particular date, the funding would stop for the rest, which was fair enough because, if we're not recruiting, there's no point in them chucking good money after bad. We did hit that, luckily, and we've just finished recruiting to target with a slight extension. Systematic reviews, again, there are ways in which you can do this through NIHR. So there's NIHR Cochrane Programme Grant Scheme, and again, the Cochrane Programme, depending on the kind of review you're doing, it can be fantastic. It won't fit any kind of review which you want to do because it's usually about comparing intervention A to intervention B. But if it fits within that, there's loads of support, and it's a real kind of Rolls-Royce service. And there are incentive awards too. The School for Social Care Research is in some ways quite different to the others. It's not a huge school in terms of funding, compared to many of the others. And it largely puts its money into a network of research units. But it does have periodically open research calls for research in social care. And they sometimes set some very broad themes, but those themes are really quite broad, so you can fit lots of things within them. And that's, with its focus on social care specifically, that's quite unique within kind of the NIHR family of research funders. One set of NIHR research funding, which I think is really good to know about, are fellowships. How many people have heard of NIHR fellowships of various sorts? Yeah, quite a few. That's great. Because I think, because I sat on the doctorate fellowships program for some time, and kind of seeing the people coming through that and then going into fellowships and then kind of going on to research careers, I think they're a great scheme, fantastic opportunity for people. They have research fellowships at a wide range of levels, doctoral, postdoctoral, through to research profs. It's an annual application round. And again, unlike the others, because fellowships are interested in the individual as well as the research program, they interview you, which is a really important part of the process, actually. One of the good things about fellowships is that they fund you at a waged level. So, for example, if you're doing a PhD, they don't fund you at the level of having a studentship. They fund you at your current wage level, which I think is helpful. You can do them full-time, or you can do them less than full-time. So 75%, for example, you could do it over 4 years at that rather than full-time for 3 years. And I think they're a really great opportunity for you to do some research, but also learn so much. So they're very interested in how you develop as a person. So they're very keen to fund if there's kind of additional training or opportunities for you to become the person in a particular method. They're looking for those things. So they're really worth having a look at. The applications normally have to be in kind of early January, roughly now. So they've just been launched, I think, or they're about to be launched. They're worth spending some time putting together. So you need to be the right person at the right stage in your career. You need to have a good research idea, and you need to be doing it with good supervisors in a place that makes sense. But they're worth having a look at. So that's a quick overview of NIHR funding schemes. And with all of these, it's worth spending some time on their websites, having a look at what they say they fund. Quite often they have quite good guidance on, actually, we're interested in this and we're not so interested in that. And because things are changing and new themes are coming out all the time, it's worth just exploring, they've also got information on what they've funded, what's come through, those kinds of things. The RDS, well, we're here to provide advice on research design to researchers who are developing proposals for national, peer-reviewed funding competitions for applied health and social care research. So the applied bit is important to us, so we don't provide advice on very basic lab science type stuff. The schemes include NIHR schemes, but they don't have to be NIHR schemes. So as long as it fits within applied health or social care research, it's a national funder, and it's open competition, peer review, then we will provide advice. So, for example, research councils or charities, medical charities or other charities, we will quite happily give you advice on those too. And that is an explicit part of our remit. And basically, we're trying to help you get to the point of submitting the best proposal you can. That's our job. That's no guarantee that you can fund it or that they will fund it. But it's, we will try and get you to the best point you can. And we in some respects are kind of the honest broker. So if we think your proposal needs a lot more work, we will tell you that. rather than encourage you to submit where we think actually it could be much better. We're a national service, and we work through regions because that's the way that we're funded, but also that's the kind of the way that makes sense in terms of trying to reach everybody around England from one kind of national hub will be tricky. So we're a national service with hopefully a local footprint, with our tentacles extending everywhere. So we are the Northwest. This is the footprint of the old regions. Whether they're going to come back, I don't know. And we're divided into 3 zones. So we are, in terms of funding and in terms of research funding obtained, that people obtain, and in terms of area, well, area we're kind of big. But in those 2 things, we're the second biggest RDS in England after London. And we cover quite a wide range. So there's Cumbria and Lancashire there, which pretty much maps onto Clark areas, although there are some kind of fiddly bits in the corners. Greater Manchester and Mersey and Cheshire. So within the Northwest, we have kind of local offices there, so there's always somebody reasonably close to you to contact. But at the same time, we work as a region, so you will get specialist advice from the best person in the region, whether that's somebody in that little zone or it's somebody from elsewhere in the Northwest. And we try and offer expertise, I guess, in terms of methods across the whole range of methods which you need. And we get some steers on that from NIHR, but also we spend a lot of time looking carefully at people coming through. What are people applying for? What kind of expertise do people need to help them? So, for example, in terms of RFPB, the proportion of people applying to do something related to trials has increased quite a lot over time. So we've kind of beefed up our kind of trials expertise, but also our kind of links and resources with CTUs as well. So statistics, health economics, qualitative research of a wide range, health psychology and behaviour change, research synthesis, whether that's quantitative systematic reviews or qualitative evidence synthesis methods too, and also specialist methods. So we have quite a range of kind of senior specialists on retainer, so we can kind of draft people in. If you need some very kind of specialist support, we can draft people in. We also offer specific application advice for schemes. So I think an important part of our job is, if you come with a research idea, is helping you think through, well, actually, what's the best funding scheme that fits my idea? How can I shape things in different ways, and which ones might be more likely to work? And a crucial part of our role is providing advice on patient and public involvement. And we like you to come to us early, because we want patient and public involvement in at the stage of working on your proposal. Because patient and public involvement can have a crucial impact on what your proposal is, what your questions are, how you frame them, how you do that research. And we can offer a lot of support around that phase. So it's really important to us that PPI shapes your proposal, as well as then that there is involvement in the study as it goes on as well. When you contact us, you might be provided with information on first contact with a service. We have lots of online resources which are worth you checking out. You might be directed to a different source of help if it turns out actually you're not, the kind of support you're looking for is not within our remit, but we can point you to other helpful people if that's the case. If you're eligible for our advisory service, and that just means you're working on a proposal that might fit within our remit, you fit, basically. So we don't turn people away. It's absolutely our job is to help you. For individualised support, we ask you to complete an advice request form. This is really very straightforward, but it just helps give us a sense of the kind of things you're interested in, the kind of support you think you might need at that point. Obviously, the support which you get, can change over time as things progress. And it helps us try and match an advisor to the kind of support which you need. So we call our frontline advisors, and they are academics working in universities around the Northwest. And they will basically be your kind of case manager, really. So they will offer advice on some aspects of your proposal. They will help you think through funders, but also they will link you to other people which you need support and advice from. So you have one point of contact rather than being in this kind of nebulous system. And hopefully, between us, you should get the support you need. We offer support in a wide range of ways. So depending on what suits you, we can do face-to-face meetings, or it might be email, phone, Skype, any way that works for you, because we know you're all busy. So any way that works for you, we will do. We can help you kind of shape up your research idea into, well, how does that translate into a specific research question? We can look at whether those fit into scope for particular funding streams, and if not, can we shape them into those? How to design your research. We also offer support on kind of building a dream team. So often for early career researchers, a real issue is, is a funder going to think that I'm a credible person to do this piece of research? Because that is something that funding agencies look at. So we will help you, if you need a specific, a health economist, we will help you find one who will help you shape your bid and maybe be a co-I if that fits. So we can help you working to kind of build teams of people to get your research into the best shape in a way that looks credible to funders. We can offer advice on research methods, analysis too, which obviously is really important, again, to be credible. So you've got to convince the panel that you know what you're doing, that you're not just collecting data with no idea of how you're going to analyse that you've got enough people to do the analyses you want to do, those kinds of issues. We also offer a public involvement fund up to £350. Applying for this is a really simple process, a very simple form to fill in, and we try and get decisions to you quickly. And this is to help support getting public involvement in the process of you working at your proposal. So it helps to fund, if people need support with travel to come to a meeting, to kind of talk through those things, or refreshments, or those kinds of things. So it's to help support getting public involvement into your proposal very early on. We also do critical read-throughs of proposals at different points depending on when suits you. So, so I do a number of these. So you receive a draft proposal from the point of view of a kind of potential panel member, kind of reading through it thinking, does this make sense? Has it kind of sold the topic to me? Is there coherence across? Do the methods look credible? All those kinds of issues. So we offer critical read-throughs and advice. And as I said, come to us early. Early is good. Coming to us 2 weeks before the deadline, we're limited in what we can do. But coming to us early, then it might be more useful to you. We also do a number of targeted funding stream support meetings. So, for example, we do around the RFPB scheme, we do seminars, and also we do a kind of learning set process where as groups you can get support for kind of building up to a specific funding scheme, and we have a mock review panel where all your draft proposals, basically you get to review each other's proposals, which is scary. But what it really does, actually, is really good at making you realise that sometimes what you know isn't necessarily what's on the page. So you know it inside out, but you haven't necessarily communicated that to what are mostly going to be non-specialists in your area who are on the panels. So most people on panels will be kind of senior, and they'll be experienced in research, but they might not necessarily know about your specific field. You've got to convince them that your project makes sense, your proposal makes sense. We're also more than happy to do outreach presentations anywhere, everywhere around the Northwest. We're more than happy to come and chat about the RDS and then about people's ideas and how they can fit anywhere in the Northwest. So if you're interested in those, do contact us, and we're more than happy to come and do that. We also have our website too. The website provides a signposting service. It also offers you get flashing up, this this is the deadline for this program. So there's those kinds of things, news, funding alerts. You can get access to our advice service through it, lots of self-help resources, lots of stuff. That's what it looks like. So if you find it, or when you, let's be optimistic, when you find it, there's loads of great stuff on there to have a look at, including things like the PPI how-to guide. So this is an interactive guide, takes you through some of the steps in kind of working on PPI in your proposal. We've also recently put on the site, this has taken some time, but it's really worth looking. If you're interested in doing anything relating to a clinical trial, it's an essential online resource with links to all the things you would need to think about, all the regulations you need to think about, the places you need to go. So again, for example, the trial I was involved in, it would have been fantastic if this was it then. It'd be really helpful in terms of pulling that stuff together, making it much easier to find and much easier to navigate your way through. So you could ring us, you can email us, you can contact us through our website, and please do. It is absolutely our job. This is what we in the RDS, this is absolutely what we want to be doing. We want to be helping and supporting people. So that's my ramble. So has anyone got any questions or thoughts or things they want to talk about, ideas or?
Hi, I'm Alison. I'm the R&D manager from Royal Bolton Hospital. At the moment in Bolton, we've not really got a lot of NIHR research going that is from Bolton. So we're involved in a lot of other people's projects, and we want to try and get things off the ground. Want to get more of our clinicians involved in doing research projects, and there must be ideas out there. Is there a way that your service could help us to sort of get people more on board, or get people coming to us with their research questions, and supporting us that way, just to get things off the ground? Absolutely, we'd love to do that. So the thing to do, if you contact us initially, if it's okay, we'll get a member of the RDS team to come and talk through with you, I guess, what your position is in terms of the trust, and I guess what might be the good places to start in terms of identifying maybe areas or people or groups of people or things which you might be interested in. I mean, there are plenty of other trusts in your position around the northwest, and some of them have kind of started that process some time ago, and we've been kind of helping them at points in that process, and it takes a bit of time, and often there are stages. So being a site of other people's research is actually a really helpful starting point, because you've got a whole bunch of people then in your trust who at least know what research is, know what, if you like, the kind of constraints are, I think, on that. So I think that is really useful. And then it might be a question of identifying people either to be, maybe start small with something. So find a funding scheme where people can start that isn't too kind of onerous, because the NIHR application process isn't always the easiest in the world. And clinicians sometimes say, well, actually, it takes us a long time, and there's a massive form, and it takes ages to get a decision. And in kind of a world where people are busy and other priorities, that can be the thing which falls off the list. So I think it's maybe finding something small, or it may be finding something where, rather than just being a site, you can find people who can be a co-applicant in a team. So do something kind of with other people, either locally or kind of further away. So start to kind of build things up, because the jump from clinician with a good idea to actually PI on a research proposal that gets funded can be quite big, I think. So it's finding kind of sequential steps, I think, for people. But we'd absolutely love to come and talk to you and work a strategy. Oh, that's great. Thank you.
Oh.
Hi. I just wondered what the RDS official line is on how you should who should be the PI on a project. Clearly you need some experience, but does it have to be... my feeling is the person who thought of the idea and is going to be doing the bulk of the work should be it. But would they have enough experience for that to get funded?
We would have to. I think it varies program by program. Certainly for things like RFPB, the line from NIHR is absolutely that. If you are the person who originates the idea and drives it, even if you're not experienced, it's fine for you to be the PI. They would look for a credible team around you as co-applicants, I guess, so that they would look at the team as a whole and say, yes, I'm convinced this can work. But also with this kind of new 100,000 level, that can be potentially riskier as they phrase it. And I think that means that, again, there's potential there for people with less experience in research to be the PI and drive things. Because, of course, more experienced senior people start to add a lot of cost. so there are a range of things to bear in mind, but certainly for programs like RFPB and other ones too, their line is yours exactly. That even if you're not the one with the experience, you can be a PI because it's your idea and you're driving it, as long as there are other people around you. And fellowships too, actually, are another great vehicle for early career people to get going, because you need to be, your supervisors need to be senior and experienced and credible in a credible place, but it's very much about you and developing you. So again, they're a great way to launch you, if you like, particularly at those earlier stages, because NIHR now are quite specifically saying they're looking for people who get research fellowships to be going on to applying for RFPB as PIs, those kinds of things. So I think there are routes in. It's just making sure you hit the right scheme.
Yes, it seems a little bit chicken and egg sometimes, or you can't be a PI because you haven't got experience, and you can't get experience because...
Yes, but I think NIHR are very much recognising that now, and are finding ways to make sure that their rhetoric around that matches with the reality of what happens to people. Oh, the microphone's coming your way.
How important is the role of the university or the academic institution that is supporting, say, for example, the fellowship applicant? Do we need a good university who has established research profile in a particular area? Or should we go for a person who has, a lot of research in that particular area, but may not be working at a good university that has that kind of research profile? Sorry.
I'm not sure what to talk about. Good universities versus not. They're all good, obviously.
No, I know they're all good, but you know what I mean.
I know your point exactly. I think in a fellowship application, it's a judgment you need to make as a fellow. So if there's... I guess the panel has to be convinced that you will get the support you need, supervision you need, that will kind of launch you, I suppose. That not only will you get your research done, but that they will help kind of mentor you and get you to that kind of next stage. So if your supervisor is someone who's doing loads of kind of relevant stuff and they're really experienced and they've supervised PhD students before, then if the institution as a whole isn't doing much of that, I think that would be fine. I think the supervisory team themselves, because it's always a team, it's not just one. And you also, panels are also, I guess, quite savvy to, they will also wonder if you put on an incredibly senior name who is incredibly famous and well respected, but they're also apparently supervising 30 other PhD students at the same time, then they'll be asking questions, well, how much supervision are you actually going to get? And is that actually the experience you're going to need? So it's a question of kind of weighing it all up and trying to put that kind of package together. So you have to convince the panel that you're in the right place with the right people as supervisors. I think the other thing to think of with fellowships is that all your training and support doesn't have to come from one place. So they're quite often looking for additional training, for example. There might be some very specialist training somewhere else. Or you might be looking for a mentoring relationship with someone who's kind of the person in that field. And that might not be a very formal or frequent relationship, but they're looking for those kinds of things, that you've got that ambition, I guess. And that's not only drawing from where your PhD would be, but it's drawing from other places and people too.
Can I ask another
Yeah,
question? This whole team, I understand that there needs to be a varied team that you need to bring together. Who kind of thinks, because sometimes if you don't know who the leading lights in that particular area are, or you might know one or two names who may be incredibly busy but are incredibly famous as well. So, how do you get that information as to who to put into the team?
Yeah, I mean, you need to match your team to what you need. So sometimes there's, you don't need necessarily a very varied team. And sometimes in some projects, the idea, you have to have some health economics and everything. Well, sometimes you will talk to our health economists and they'll say, actually, there's no point. Don't waste your money on it because you wouldn't find out anything useful and it's just kind of wasting money which you could put into other elements of the project. So it's working out what team you need to do what you need to do. But the RDS can help you with trying to find contacts and connections to the people which you need. But for us, it's quite important that if it's your idea that you're in control of that process. So, great idea, great proposal, that it's not taken out of your hands and kind of someone else kind of takes it on and then you're kind of sidelined. That's absolutely not what we want to happen. So it's important for you to drive that and control that, but we will advise you and support you on people to contact. And also many academics are just pathetically grateful if anyone's interested, to be honest. So often, even though they might be busy, they, more often than you might think, they're interested in helping.
Thank you.
Thank you. In terms of the doctoral fellowships, does the integrated research application come out slightly later? And what's the stance on applying for? I know there's different types. I know there's one for all types of scientists and one for more AHPs and nurses. Yeah. Does that make sense?
Yeah. I mean, it's worth having an individual consultation with an RDS advisor to talk you through the wrinkles of all those schemes and how they fit and which might fit for you. In terms of applying at the same time for different fellowships, there are many people who apply kind of simultaneously for, say, an NIHR one and an MRC one and a Wellcome one, and that's fine because all the funders recognise that that you can't expect to apply to one and then wait a year if you're unsuccessful for the next one. So applying across those is fine. And I think it's really trying to work out the schemes which work best for you. I mean, the success rate for fellowships isn't bad. I think it's about, for the doctoral fellowships, it's about 25%, I think, 20-25%, which isn't bad, actually, compared to many others. And again, we can help you on, whichever scheme you go for about research design. We also do kind of mock interviews, for example, for people, which again is another one of the scary things, but people have found it incredibly useful in terms of shaping their presentation, what kind of questions they might get, the things they need to think about at those points. So it's worth having an individual consultation about those specific schemes and how they fit with you.
Just a general comment question as well. Is it possible to have sight of the public health projects that have been funded?
Yes.
That's good. So how do we email or?
Well, through the RDS Northwest site, that gives you links to all the sites for the NIHR programs. So you go through to the public health research site, and there's a big long list of things that they've funded there. So it is, I think, for any scheme which you're thinking of applying to, it's worth having a look at what they've funded recently. Because that does give you a really good steer.
Yeah, because that's what I was thinking, just to get an idea of what type of projects are funded.
Yeah.
Public health ones, because I'm a public health analyst. So, and we have a number of projects in our head.
Okay.
But, I mean, it's been very useful because I didn't realise that public health projects can be funded as well.
Yeah.
So that'll be
yes,
useful.
and they're they're actively looking for stuff.
Oh, good. Thank you.
And again, it's really worth you coming to talk to the RDS about that, because also there are things like the MRC have a FIND scheme, PHIND,
Yes, that's
which is
correct.
kind of quite small scale, but it's very fast track. So things like that, so we can help you kind of scope which schemes are out there and which ones might fit.
That's great. And you mentioned presentations before, outreach presentations. Could we request RDS to come to public health? Do you do that? Will they do that?
Yeah. We'd love to.
So
yeah.
come and talk to Lancashire County Councils.
Yes. Oh, yeah.
Yeah. Great.
Yes.
So I can arrange
Because
that
well, we don't have as good a profile with councils as we want to have, so that'd be fantastic.
Oh,
I'd
that'd
love
be
to.
great. So I'll try and
Yeah.
arrange that then.
Count us in.
So I'll just drop an email to someone.
Yep.
That's great.
Yeah. My email's chris.hatton@lancaster.ac.uk.
So we can.
Sorry,
that's
Chris.
great,
Yeah. It's all lowercase.
Okay.
So if you email me about because I guess I'm kind of in public health as well. So
Oh, that'd be great
So-
then. Thanks. Thank you.
yes. Do have a look at the site. Do contact us. Whether it's about coming to talk to you, doing a presentation, about individual advice, about kind of funding schemes, please do. Thank you all very much for being so interested. It's great. Thank you.